हाय फ्रेंड्स, वेलकम टू ईसी नर्स वेयर नर्सिंग एजुकेशन मेड ईजी। सो आप लोगों का एग्जाम्स आ रहे हैं, सो डोंट वरी अबाउट द एग्जाम्स, वी विल डिस्कस द इम्पोर्टेंट क्वेश्चंस फॉर द अपकमिंग एग्जाम्स। सो टुडे हमारा सब्जेक्ट है मेंटल हेल्थ नर्सिंग। सो हम लोग आज डिस्कस करेगा मेंटल हेल्थ नर्सिंग का इम्पोर्टेंट क्वेश्चंस फ्रॉम सेकेंड ईयर GNM। सो शुरू करते हैं। So first we will discuss about some of the words meanings. So आप लोगों को एग्जाम में meanings लिखने के लिए क्वेश्चंस आएगा। So हम लोग डिस्कस करेगा थोड़ा meanings, words meanings. Let's discuss. So first हम लोग डिस्कस करेगा phobia. So what is phobia? Phobia क्या मतलब क्या है? So phobia means it's an intense, irrational and persistent fear of a specific object, situation or activity. So वो व्यक्ति को or that individual have a fear about something. So have a consistent or a persistent fear about any object, maybe any situation or maybe any activity that he will avoid that situation. So he or she will try to avoid that particular situation and that is interfering with their daily life. So that is what called phobia. Phobia is nothing but just a fear. It's not just a fear, it is a consistent, persistent fear so that person's life activity will disturb. वो बोलते हैं phobia. So definition समझ में आ गया क्या? Phobia. So हम लोग डिस्कस करेगा नेक्स्ट, दैट इज यूफोरिया। सो क्या है यूफोरिया? Euphoria is a feeling or state of intense happiness, excitement and well-being, often exaggerated and not necessarily related to actual circumstances. So it is feeling of or a state of, that person is in the state of intense happiness or excitement. So that condition is known as euphoria. So it is maybe often exaggerated and not necessarily related to actual circumstance. So that is euphoria. सो नेक्स्ट हम लोग डिस्कस करेगा रैपोर्ट। सो रैपोर्ट का मतलब क्या है? सो रैपोर्ट इज अ हार्मोनियस एंड ट्रस्टिंग रिलेशनशिप बिटवीन इंडिविजुअल्स characterized by understanding, respect and good communication. So we are making a relationship with others with our communication, respect and understanding. So that is what called rapport. So rapport is a harmonious and trusting relationship between the individuals. So characterized by, कैसे हम लोग characterize करेगा इधर? It is understanding, respect and good communication. So that is rapport. नेक्स्ट डिस्कस करेगा apathy. So what is apathy? It is lack of interest, emotion or concern towards things that typically evoke feeling such as events, people or activities. So that person will not having any interest or he is having lack of interest or concern towards the thing that is typically evoking feelings like such as events, people or activities. He will be uninterested in people or activities or events. So that is what called apathy. क्लियर? कुछ डाउट है तो नीचे कमेंट में मैसेज करेगा तो हम लोग वो आंसर दिएगा। सो बाद में हम लोग अभी डिस्कस करेगा अक्नोशिया। सो व्हाट इज अक्नोशिया? इट इज अ इनएबिलिटी टू रिकॉग्नाइज और इंटरप्रेट सेंसरी इंफॉर्मेशन. सो दैट पर्सन विल हैव डिफिकल्टी इन आइडेंटिफाइंग और recognizing the sensory information despite having normal functioning of sensory organs and memory. So the sensory organs and memories does not have any problem, but then also that person is unable to recognize the sensory stimulus. So that is what called agnosia. So it is the definition. Clear? So next हम लोग डिस्कस करेगा amnesia. So what is amnesia? It is the loss or impairment of memory. So memory loss or impairment of memory को बोलते हैं amnesia, which may be partial or complete. Either partial, half memory loss will be there, or complete memory loss, and affect short term or long term memory. So this is defined as amnesia. It's a loss of impairment of memory which will be partial or complete and can affect short term or long term memory. So now we will discuss about anxiety. So what is anxiety? It is everybody will get an anxiety in their lifetime. So what is anxiety? It's a feeling of worry, nervousness or unease typically about imminent event or something with uncertain outcome. So it is related to some event or some related to something that will come uncertain outcome. So that person or us, we will feel what? Nervousness. We will feel nervousness, uneasiness and worrying. So that is what called anxiety. नेक्स्ट हम लोग डिस्कस करेगा एम्बिवैलेंस. सो एम्बिवैलेंस का मतलब क्या है? एम्बिवैलेंस इज द प्रेजेंस ऑफ मिक्स्ड और कॉन्ट्रैक्टरी फीलिंग और एटीट्यूड टुवर्ड्स पर्सन, ऑब्जेक्ट और सिचुएशन. सो एक पर्सन और ऑब्जेक्ट और सिचुएशन को हम लोगों को एक मिक्स्ड फीलिंग हो जाता है. सो वो मिक्स्ड फीलिंग को कहते हैं एम्बिवैलेंस. सो एम्बिवैलेंस इज द प्रेजेंस ऑफ मिक्स्ड और contradictory feelings or attitudes towards person, object or situation. So that is ambivalence. Next, aphasia. So what is aphasia? It's a language disorder. So aphasia एक language disorder है that affecting the person's ability to communicate. So it will affect the person's ability to communicate with others, typically caused by the damage to brain. So brain damage के बाद में this problem will develop here. That person is unable to communicate to other person, especially in the left hemisphere. So they have in the left hemisphere, if they are getting that injury or brain trauma, then it will lead to aphasia. Clear? So next one is clang association. So what is clang association? It's a speech pattern in which words are chosen based on their sound rather than meaning. So here that person will use the sounds is based on their sounds rather than meaning. So what they are speaking, they does not have any meaning. They'll see the rhyming pattern, often in rhyming or having similar beginning sound. It is commonly seen in schizophrenia and other thought disorders. So here क्या बोलते हैं वो लोग while speaking वो लोग यूज करेगा राइमिंग वर्ड्स. वो मतलब नहीं है वो वर्ड का और वो सेंटेंस का कुछ मतलब भी नहीं रहेगा. सो विल यूज ओनली rhythmic and rhyming words. So mainly seen in the case of a schizophrenia. So this is clang association. Coming to deja vu. So what is deja vu? It is a false feeling that new situation or experience has already seen or experienced in the past, even though it is happening for the first time. So sometimes what will happen, that incident is happening in the first time, but we will feel, oh, this situation I have encountered, oh, I seen this situation before I had experienced this situation. So that is what called deja vu. So it's a false feeling. So it is a false feeling that the new situation or experience has already experienced in the past, even though it is happening for the first time. That incident first time happening. So what we will think, oh, we have seen this incident, so we have encountered this incident. So that is what called deja vu. It is a false feeling. Clear? So next one, discussing delirium. हम लोग डिस्कस करेगा delirium. क्या है delirium? It's an acute sudden onset disturbance in attention, awareness and cognition. So it is disturbance in the awareness, attention and cognition, and is caused by illness, medication or substance use. It is usually temporary and reversible. So here it is a acute sudden onset disturbances in the attention. So that person will have disturbance in attention, awareness and cognition, thinking capacity. So it is caused either due to illness, medication or any substance use. It is usually temporary and reversible. So this is the definition of delirium. Now let's discuss about delusion. So what is delusion? It's a false fixed belief. So that person have a false fixed belief that is not based in reality and is resistant to reasoning or contrary evidence, often in psychiatric condition like schizophrenia. So that person will have fixed beliefs, false fixed beliefs. So that we are telling something, that person is telling something and it is wrong, then also if he will say that it is truth. So that is false disbelief. So that person will have false fixed belief that is not based on the reality. So it is mainly seen in the case of schizophrenia. So next we will see about dementia. So क्या है dementia? Dementia is a progressive decline in cognitive function. So progressively, slowly, there will be decrease in the cognitive function, including memory, thinking, reasoning and ability to perform daily activity. So here it's a progressive decline. So this progresses, its time passes, what will happen? That person have the problem of ability to do the personal life activities also, often due to damage or disease affecting the brain. So brain is affected with disease or damages. क्या होता है? Progressive decline in the cognitive function like memory, thinking, reasoning and the ability to perform daily activities. So that's the definition of dementia. Coming to echolalia. So what is echolalia? It is involuntary repetition or imitation of other person's spoken words. So if I am telling something that patient is having this echolalia, he will also mimic me. He will also start to repetitive what I am saying. So मैं क्या बोल दिया वो लोग वो repeat करेगा. That condition is known as echolalia. It is the involuntary repetition or imitation of other person's spoken words, often observed in the condition like autism spectrum disorder and schizophrenia. So वो लोग को हम लोग मैं एक बात कर रही हूँ, schizophrenia patient मुझे follow करेगा और imitate करेगा. मैं क्या बोल दिया वो लोग भी और repetitive और repeat करेगा. So that condition is known as echolalia. It is the involuntary repetition of or imitation of another person's spoken words, often observed in conditions like autism spectrum disorder and schizophrenia. Now next one we will discuss echopraxia. So what is echopraxia? It is the involuntary imitation and repetition of other person's movement or gestures. So echolalia, the words they are repeating, but here in his echopraxia, that person will repeat their movements. So if I am doing some movements, that person will try to copy my movements. So that is echopraxia, is the involuntary imitation or repetition of another person's movements or gestures. So it is involuntary it will come, commonly seen in neurological and psychiatric disorders such as schizophrenia. So it is echopraxis, an involuntary imitation. So that person will be involuntarily imitating or repetition of another person's movement or gesture. So they will copy the movements and gestures of another person. So that is echopraxia. Coming to flight of ideas. So क्या है flight of ideas? It is the rapid and continuous flow of speech. So rapid and continuous flow of speech without abrupt changes from one topic to another, often loosely connected ideas commonly seen in manic episodes. So jumping of ideas from one topic to another, he or she will directly jump without any meaning or without continuing or without completing that sentence, they will go to the next topic. So that is we can see in the case of manic episodes or in mania. So that is flight of ideas. So क्या है flight of ideas? It's a rapid and continuous flow of speech with abrupt changes from one topic to another, often based on loosely connected ideas. So एक jump हो जाते हैं from one topic बात speaking. So while बात करने के time one topic से another topic को जल्दी से change करेगा without any meaning. So that is flight of ideas. Now let's discuss about grief. So what is grief? It's a deep emotional responses to loss. So that person to had a loss of a death of a loved one. It's a loss. So grief is a deep emotional response to loss, especially the loss of someone or something meaningful, often involving sadness, pain and range of other physical and emotional reaction. So that is grief. It is the emotional response to loss, especially the loss of someone or something special. Clear the grief? So now let's discuss about it. What is it? It's the part of personality in Freud's psychoanalytic theory. So it's a part of, it is a part of personality, and we can see that in Freud's psychoanalytic theory, containing instinctual drives and desire. It operates on the pleasure principle, seeking immediate gratification of needs and urges without considering the reality or consequences. So without considering the reality and consequences, that person will immediately seek for the gratification from needs. So that is what called id. It's a part of personality in Freud's psychoanalytic theory. Clear? Any doubts till now? Yes, we will continue with the next question or next meaning of the word is intelligent quotient. So what is intelligent quotient? It is also known as IQ, standardized score to measure a person's cognitive ability or intelligence level. So it is a standard test we are using to do or measuring the person's cognitive abilities and intelligence level, neither in relation to their age group. It is typically derived from intelligence test and reflects skills like reasoning, problem solving and understanding. So it is, we can use this formula to calculate the IQ of a person. Mental age by physical age into 100. Yes. सो हम लोग अभी नेक्स्ट डिस्कस करेगा द वर्ड नियोलॉजिज्म. क्या है नियोलॉजिज्म? इट्स अ क्रिएशन और यूज ऑफ न्यू मेड अप वर्ड्स और फ्रेजेस दैट मे हैविंग मीनिंग ओनली टू द पर्सन यूजिंग देम. सो वो लोग एक नया वर्ड फॉर्म करेगा, एक नया वर्ड, और एक दे विल ओनली मेक अप वन वर्ड विदाउट एनी मीनिंग. उनका उसका मीनिंग वो लोग को पता है, हम लोग को नहीं पता है. वो लोग कुछ अच्छा सा न्यू वर्ड्स मीनिंग फॉर्मिंग करेगा, वो है नियोलॉजिज्म. Neo means new. Neologism means new words. So here it is, neologism is the creation or use of new made up words or phrases. So that is a new word or a made up word by themselves that patient will develop his own. So the meaning only they knows, we don't know. So that is neologism. Now let's discuss about obsession. So what is obsession? It is the persistent, unwanted and intrusive thought. It is a persistent, unwanted and intrusive thought, image or urge that causes anxiety or distress, commonly seen in obsessive compulsive disorder. So that person have persistent, unwanted thoughts will be there, like thoughts or images or urge that causes anxiety or distress. So that is what called obsession. Next we will discuss stupor. So what is stupor? It is a state or near consciousness, state of near consciousness, near unconsciousness or unresponsiveness in which the person is awake but shows little or no awareness or no reaction to the environment. So here that person is nearly unconscious and unresponsiveness, but the person will be awake but show little or no awareness about the environment. So that condition is known as stupor. It is also known as near consciousness level. Next we will discuss about superego. So what is superego? It's a part of personality in Freud psychoanalytical theory, and that represent internalized moral standards, values and ideals. So it is based on the values, more standards and ideals. It acts as ethical component guiding the behavior of based on what right or wrong and striving for perfection. So it is guiding the principle of what is right, what is wrong, and also striving on for perfection. So that is superego. Clear till now? Next word we will discussing about it is tangentiality. So what is tangentiality? It's a communication disturbance where a person responds to a question with an irrelevant or only loosely related answer, often in schizophrenia and other thought disorders. So here what happens if you are asking some questions to that person, so there will be the response of the question will be irrelevant, so the answer will be irrelevant to that question, so it won't be matching with the question what we have asked. So it is mainly seen in the case of schizophrenia. So that is tangentiality. So we are asking something and they are replying something different, entirely different from the topic. Next is tic. So what is tic? It's a sudden, rapid, involuntary movement or vocalization that is repetitive in nature, often seen in conditions like Tourette syndrome. So in the body movement will be sudden, rapid, involuntary movements will be there, and it is in repetitive manner. So that person will have repetitive or repeatedly sudden, rapid, involuntary movements will be there. So we can see that in the Tourette syndrome. So next is word salad. So what is word salad? It is confused or incoherent mixture of random words and phrases that are lack in logical connection, often in severe case of schizophrenia or other psychotic disorder. So they will speak continuously so many words without any meaning. So that is what called word salads. From here, there, they will speak so many words without any meaning. So that is word salad. So it is confused or incoherent mixture of random words. So it has no connection between each other and no meaning also. So that is word salad. So these are the meanings we have discussed today. So that are the meanings it will come for, write the meanings about this coming for the exam. So study well, and if you have any doubts, please comment below. So now we are going to discuss about some fill in the blanks question. So पहला question हम लोग का ECT was introduced by whom? कौन इंट्रोड्यूस किया है ECT? So what is it is ECT? Electroconvulsive therapy. So कौन इंट्रोड्यूस किया है? So the answer is Ugo Sertelli and Luciano Bini in the year of 1938. So clear? ECT किसने फॉर्म किया है और इंट्रोड्यूस किया है? वो है ऊगो सर्लेटी एंड लुसिनो बेनी. So next question is antipsychotic drugs are also called. So antipsychotic drugs को एक और नाम है. What it is? Or it is also known as क्या है? Major tranquilizers. So it is also known as major tranquilizers. Dash is the written word record of conversation between patient and nurse. So how we will record the conversation between the patient and nurse? It is through process recording. So the process recording is where the written word record of conversation between the patient and nurse. So next fill in the blanks है. Indian Lunacy Act was passed in the year. Which year में Indian Lunacy Act pass हो गया? तो which year है? वो it is 1912. So पहले 1912 में the rule of Indian Lunacy Act was passed in the year 1912. Next question. Rehabilitation is the component of dash level of prevention. So at what level of prevention we have rehabilitation? So वो है tertiary level of prevention. So rehabilitation is the end. So not in the primary and secondary, in the tertiary level, in the third stage of prevention, we will use rehabilitation measures. Next is pre-morbid personality is what? So what is pre-morbid personality? Typically referring to a personality trait. So it is a personality trait. Example, personality before the onset of illness. So that is pre-morbid. Before the onset of illness, that is pre-morbid personality. Coming to the next question, the word schizophrenia was coined by whom? कौन? The word schizophrenia पहले बोला था और coin किया था वो है Eugene Blower. So Eugene Blower has discovered the word schizophrenia. So these are some filling the blanks. We will continue with the filling the blanks. So the nurse-patient relationship is dash oriented. So what it is? It is therapeutic oriented. So it is therapeutic nurse-patient relationship. For the treatment of patient, the nurse is having a relationship. It is called therapeutic relationship. The most common side effect of antipsychotic drug is, so antipsychotic drug का most common side effect क्या है? So क्या है? So the answer is extrapyramidal symptoms, EPS. So that person will have EPS, extrapyramidal symptoms. So that is the most common side effect of antipsychotic drug. Next question, dash is disorder characterized by alternating periods of mania and depression. Alternating periods, sometimes mania है, sometimes in depression. तो क्या है? वो disease को क्या बोलते हैं? It is bipolar disorder. So bipolar disorder, either that person is in mania or either that person will be in the depression stage. So that is, the disorder is characterized by alternating periods of mania or depression, that is bipolar disorder. So next one, the therapeutic technique is used to help patients in express suppressed emotions is called what? So it's a technique we are using to help the patient to express their feelings. So what it is called? It is known as catharsis. So the technique is catharsis, where the therapeutic technique, it's a therapeutic technique used to help patient to express suppressed emotions, that is called catharsis. Clear? So next is, dash is a defense mechanism where an individual attributes their own unacceptable thoughts to others. Like that person done a mistake and she is telling, no, I didn't do in that mistake, my friend does that mistake. So that is what called, it is called that is attributing their own unacceptable thoughts to others. So what it is projection. So projecting that, she is projecting that I didn't do that mistake, my friend does the mistake. So that is what called, it is projection. It's a defense mechanism where an individual attributes their unacceptable behavior to others. So that is projection. Yes. So we have discussed some of the fill in the blanks. I hope everyone understood. So if any doubts you have, please comment. We'll answer your doubts. So next हम लोग discuss करेगा some true or false question. So the first question is, schizophrenia is a mood disorder. Is it true or false? Yes, it is false. So because it is a psychotic disorder, schizophrenia is not a mood disorder, so it is a false statement. Yes. So coming to the next one, electroconvulsive therapy or ECT is used in the treatment of severe depression. Is it true or false? Yes, it is true. So we can use, in case of severe depression, we are using ECT, so electroconvulsive therapy. Next is delusion is the false sensory perception. Is it true or false? Yes, it is false because that describes hallucination. Delusion is a false belief. Delusion is not a false sensory perception. It is a false belief. So it is a false statement. Coming to next question. Mental illness is always hereditary. Is it true or false? It is false because it can be due to multiple causes, not only genetic factors. Genetic factor is one of the reason, but it is not every time. It is not genetic factor. So it is have multiple factors like biological, psychological and environmental factors. So it is a false statement. Next is anxiolytic drugs are used to reduce anxiety. Is it true or false? It is true because we are using to control or to treat anxiety. We are using the drugs anxiolytic drugs. Next is hallucinations can occur in any 5 senses. Is it true or false? Yes, it is true. So any 5 senses, like it can be auditory, sensory auditory, or visual hallucination, tactile hallucination, also the smell, olfaction will be there, and the touch, tactile will be there. So it can be in the 5 senses. It can occur not only auditory and visual hallucination. So it's a true statement. Hallucination can be occurring in any of the 5 senses. Next is lithium used as a mood stabilizer. Is it true or false? It is true. So lithium is a mood stabilizer used in the cases of mania and depression. Yes, so we'll continue with some of the difference between some of the words like hallucination and illusion. So let's see what is hallucination and illusion. Hallucination is a false sensory perception. So it is a false sensory perception that occur without any external stimulus. So without any external stimulus, that person will have false sensory perception. Like there won't be that person is seeing snake instead of rope. Rope is there, but that person will perceive as or sensory stimuli he will perceive it is snake. उधर एक rope है, एक piece of rope था, but वो लोग को क्या है, वो लोग visual sensory perception गलत होते हैं, तो वो लोग बोलते हैं उधर snake है, rope नहीं है, snake है. So that is an example. So the person perceives something that is not actually present, like hearing voices or seeing things that are not real. So that is the hallucination. It's a false sensory perception that occurs without any external stimulus. The person perceives something that is not actually present, such as hearing voices or seeing things that aren't real. So coming to illusion. So what is illusion? It's a misinterpretation of real external stimulus. So misinterpretation of real external stimulus. So that is what called the sensory output. So here the example will come. Sorry for that. Here the example will come. So there is a rope that person will misinterpret as that is a snake. So that is misinterpretation of real external stimulus. So that's an example of illusion. So the sensory input exists but is perceived incorrectly, like mistaking rope for snake. So that is hallucination where that person is feeling somebody is talking, but there won't be any person. So he will hear he will hear some voices, but there will be nobody will be there. He will see something, but there is nothing will be there. So that is hallucination. Coming to illusion, there is a rope, but that person will see as that is a snake. So that is illusion. So hallucination and illusion. Coming to the next is obsession and compulsion. So what is obsession and compulsion? Obsession is a recurrent, persistent and intrusive thought, image or urge that causes anxiety or distress. So that person will have recurrent and persistent unwanted thoughts will be there. It will cause them anxiety or distress. The person tries to ignore or suppress it but cannot control it. Example, constant fear of contamination. So they'll feel every time they'll wash their hands, they'll feel, oh, it is my hands is contaminated. So they'll multiple times they'll wash their hands in 1 hour itself. Like coming to compulsion. So क्या है compulsion? It's a repetitive behavior or mental act that a person feels driven to perform in response to an obsession in order to reduce anxiety and preventing fear event. Example, excessive hand washing relieved to the contamination fear. So in obsession, he will think my hands are dirty. In coming to the compulsion stage, here that person will continuously do the hand wash. So this is obsession and compulsion. So it is mainly seen in OCD disorders, obsessive compulsive disorder. So coming to the next one, pressure of speech and poverty of speech. So what is pressure of speech? It is a rapid, excessive and uncontrolled flow of speech, often difficult to interrupt. It is commonly seen in mania and bipolar disorder. So that person will continuously speak without any full stop, without any stop. He will continuously speak. So that is pressure of speech. It's a rapid, excessive and uncontrollable flow of speech. And the person talks continuously and jumps quickly from one topic to another. Continuously वो लोग बात करेगा और एक सब्जेक्ट से दूसरे सब्जेक्ट्स पे उतना जल्दी में जंप करेगा without any meaning. So just they'll jump from one topic to the another topic. So that is what called pressure of speech. Coming to poverty of speech, it refers to limited speech outcome. So they'll speak few words only. So where the person in grief unelaborated responses. It's commonly seen in schizophrenia or severe depression. So the person will be silent. He will speak rarely some words. Speech will be minimal and lack spontaneous content. So very slowly they will speak and speech will be very minimal. So that is poverty of speech. So it is a difference, pressure of speech and poverty of speech. Coming to next question, it is anorexia nervosa and bulimia nervosa. So what it is an eating disorder. So these both are eating disorder. Anorexia nervosa is an eating disorder characterized by intense fear of gaining weight. So that person will having a fear of gaining weight, distorted body image, self-imposed starvation leading to significant weight loss. So they'll make themselves starving. They won't eat food. So they are preferring, they'll say that, oh, my body is getting fat. I'm getting fat. So that tension will be there, fear will be there. So they'll stop to taking the food. So that is anorexia nervosa. Coming to bulimia nervosa, क्या है bulimia nervosa? It is the eating disorder characterized by repeated eating. So that person will have repeated episodes of binge eating. So she or he will eat followed by inappropriate compensatory behaviors like self-induced vomiting. After having food, they'll self-induced vomiting. वो लोग खुद vomiting करेगा. So after having the food, they'll try to vomit and they'll use laxative or excessive exercise to prevent weight gain. So after having food, they'll do excessive exercise to prevent the weight gain. So that is bulimia nervosa. So it's both the eating disorders where one here the anorexia nervosa, the person will not eat because they are afraid of getting weight. So in bulimia nervosa, that person will continuously eat and after that they'll use laxative or they'll use excessive physical activity or like exercises and also they'll induce vomiting by themselves. So that is bulimia nervosa. Yes. So now we are going to discuss some of the short answers and long answer questions. That is, first one we will see principles of mental health nursing. So what are principles of mental health nursing? Accept the patient as they are. So as an individual in the society, they also have the same right as us. So as a nurse, you need to respect and accept the patient as they are. Use self-therapeutically. So what relationship you have, use it therapeutically. Show empathy, not sympathy. You need to show them the empathy. Maintain consistency in care. So give a consistent care to your patient and maintain the consistency. Ensure reality orientation. So make sure you are doing it reality orientation to the पेशेंट रेस्पेक्ट्स पेशेंट कॉन्फिडेंशियलिटी. हम लोग पेशेंट का डिटेल्स किसी और से शेयर नहीं कर सकते. सो हम लोग पेशेंट का कॉन्फिडेंशियलिटी को रेस्पेक्ट करना है और प्रोवाइड इंडिविजुअलाइज्ड केयर. वो लोग को इंडिविजुअलाइज्ड केयर हम लोग देना है. सो प्रोवाइड इंडिविजुअलाइज्ड केयर फॉर ईच इंडिविजुअल पेशेंट. अवॉइड फिजिकल और वर्बल फोर्स. उन लोगों को फोर्स नहीं करना है फिजिकली और वर्बली. सो दे आर हैविंग अ मेंटल हेल्थ डिसऑर्डर दैट इज नॉट, वी आर not supposed to them be abused physically or verbally. Encourage patient independence. वो लोग को खुद अपना काम करने के लिए encourage करेगा like daily life activity. Promote therapeutic communication. So communication between the patient and the family as well as with the other team, it should be maintained by a staff nurse, maintained by a psychiatric nurse. So these are the principles of mental health nursing. So coming to characteristics of a mentally healthy individual. एक individual को mentally healthy है कैसे हम लोग बोलते हैं? What are the characteristics here? First one is positive self image. So खुद पे विश्वास रखना. Positive self image चाहिए. ओ मैं good looking हूँ. I am good enough. So that is positive self-image. Emotionally stable. So controlling the situations with emotionally stability should be there. Cope with stress effectively. So एक stress हो गया, एक anxiety होगा, उसको manage करने के लिए उतना strength चाहिए. If he is coping with the stress, then he is known as it's a characteristic of a mentally healthy individual. Realistic thinking. So the thinking should be realistic, responsible and productive. So they are responsible. They should be responsible and they are productive. Maintains healthy relationship with others. So the relation between the others will be healthy. Adapts to changes. So they are ready to change to the adaptation. So adapting to the changes. Self-controlled behavior. So their behavior will be how? Self-control. Has life goals and purposes. So they have goals to achieve in their life and purposes to live. Also able to grieve and receive love. So able to show the loss, grieve, move. Also able to get the love or able to receive love. So these are the characteristics of a mentally healthy individual. Next we will discuss about crisis intervention. So क्या है crisis intervention? It's a short-term, immediate and supportive approaches. It's a short-term, immediate and supportive approach used to help individuals to cope with sudden psychological crisis or emotionally distressing situation. So that person had a sudden emotional disturbance, distressing situations occurred or having a psychological crisis. Then so we will give crisis intervention. The goal is to restore the person's their previous level of functioning. So we will help them to come back to the normal physiological functioning or normal previous functioning. So that is what called crisis intervention. So coming to the features of crisis intervention, immediate and short-term support. So immediately and short-term support we are giving to the person who is in crisis. Focus on the present situation. So we need to focus on what is present, how, here and now. Aims to reduce emotional stress and stabilize the individual. So help them to control their emotional stress and also stabilize the individual. Help mobilize coping resources. So we need to monitor him and we need to monitor all the mobilizing of resources. Restore normal functioning or prevent further deterioration. So try to restore the normal functioning and try to prevent the deterioration of that again. Involve active listening, empathy and practical problem solving. So as a nurse you should be active listener, show empathy and practical problem solving skills should be there. So these are the key features of crisis intervention. So coming to the phases of crisis intervention, it is Robert's 7-stage model. First is assessment of the crisis. First we need to assess what is the crisis and establish rapport and relationship. Establish a rapport between the person and establish a therapeutic relationship. Identify the major problems. You need to identify what are the major problems. Deal with feelings and emotions. So we are going to deal with the emotions and feelings of the person. Explore alternative and coping strategies. So we need to explore what are the alternatives here, what are the coping strategies. Develop an action plan and follow up and evaluation. So these are the phases of crisis intervention. Now let's discuss about another important topic, that is ECT, electroconvulsive therapy. So what it is? It's a medical treatment for certain psychiatric disorders where small controlled electric current is passed to the brain to produce brief seizure. So here we are passing the electric current, small electric current. It's a controlled small electric current passing to the brain to produce seizures. So the seizures is thought to, it's actually, it will reduce the symptoms of a disease condition. So it is done under the general anesthesia. So that is electroconvulsive therapy, also known as shock treatment, where we are giving small controlled amount of electric current to the person's brain and producing the seizures. So the seizures are thought to relieve some kind of psychiatric symptoms. So that is why we are using electroconvulsive therapy. So clear? Doubt है क्या? कुछ डाउट है तो नीचे कमेंट में पूछो. So next we will discuss about indication. कौन सा disease condition में हम लोग ECT यूज करेगा? Mainly in severe depression, especially with suicidal risk. So severe depression वो लोग को suicidal tendency है तो हम लोग ECT will, it's a treatment protocol. In the case of mania, schizophrenia, especially catatonic schizophrenia, treatment resistant psychiatric disorders, acute psychosis. So ये डिसीज कंडीशन में हम लोग ECT यूज करेगा. ECT we will use ECT जनरल एनेस्थेशिया का, जनरल एनेस्थेशिया के बाद में देते हैं और हम लोग स्मॉल अमाउंट ऑफ इलेक्ट्रिक करंट ब्रेन में पास करेगा टू प्रोड्यूस सीजर. So it is indications are severe depression, mania, schizophrenia, treatment resistant psychiatric disorders and acute psychosis. So what are the types of ECT? It is modified and unmodified. So what is modified or unmodified is also known as direct. So what is modified? Given under anesthesia with muscle relaxant. So modified means we will administer general anesthesia plus muscle relaxant before the ECT. General anesthesia plus muscle relaxants. So coming to the unmodified or direct ECT, it is given without anesthesia and it is rarely used nowadays. So nowadays, if it is ECT is using, then that person that we are giving before general anesthesia and also muscle relaxant. So after that only we'll do ECT. So that is modified. So these are the types: modified or unmodified, also known as direct. Coming to the procedure of ECT. So क्या है procedure? Pre-ECT assessment like NPO, near oral consent should be taken, remove all the dentures and jewelry from the body. Anesthesia and muscle relaxant should be given. Next step, we will use anesthesia and electrodes applied to the scalp. So electrodes will be placed on the scalp. Seizure will be induced for 30 to 60 seconds. So post-ECT observations we need to take, vitals, and we will also need to see the patient is in confusion stage or any headache is there having. So this is the main procedure. Coming to the side effects, what are the side effects? Headache will be there, temporary memory loss will be there, confusion, muscle aches. Sometimes it is rare, but these are the side effects of ECT. So coming to the nurse's role in ECT. So क्या है nurse's role here? Prepare patient physically and mentally. Obtain informed consent. So लोग को बात करके informed consent signature लेना है. Monitor before, during, after ECT. So हम लोग को vital signs, level of consciousness सब monitor करना है before doing the procedure, in between doing the procedure and after the procedure. Provide emotional support, educate the patient and family. So this is the general nurse's role in ECT or electroconvulsive therapy. Yes, clear? So next we are going to discuss about another important topic or question that will be schizophrenia. So what is schizophrenia? It's a chronic mental disorder. So schizophrenia is a chronic mental disorder characterized by disturbances in. So what are the disturbances will be there? In thought, perception, emotions and behavior leading to loss of contact with reality. So that is schizophrenia. It's a chronic mental disorder affecting the cognitive abilities of a person like thoughts, perception, emotions and behavior leading to loss of contact with the reality. So that is psychosis. So that is the definition of schizophrenia. So what are the types of schizophrenia? It is first one, paranoid schizophrenia dominated by delusion and hallucination. So that person will have delusion and hallucination in paranoid. Catatonic schizophrenia, motor disturbance like stupor and excitement will be present. Disorganized or hebephrenic schizophrenia, it is that person will have disorganized speech, behavior or flat or inappropriate emotions will be there. Undifferentiated schizophrenia, symptoms do not fit for a specific type. So some symptoms schizophrenia will be there, but the symptoms is not for a specified type. Residual schizophrenia, fewer positive symptoms but still impaired functioning will be there. So these are the types of schizophrenia. It is mainly paranoid, catatonic, disorganized or hebephrenic, undifferentiated and residual schizophrenia. So coming to that, causes or risk factors. So what are the causes and risk factors of schizophrenia? Genetic factors like family history, neurochemical imbalances like increased production of dopamine, brain structure abnormality, stressful life event, substance abuse. So these are the causes of schizophrenia. Coming to symptoms, क्या है schizophrenia का symptoms? वो positive और negative symptom divided into positive or negative symptoms. Positive symptoms is excess or distortion of normal functioning, like they have delusions, false belief, hallucinations, false sensory perception, disorganized speech and abnormal behavior. Coming to the negative symptoms, it is social withdrawal. So it will completely withdraw from the society, lack of motivation. So they don't have any motivation, flat affect, reduced emotional expression, poverty or speech. They won't speak. So we have already discussed poverty or speech. So these are the signs and symptoms. It is positive symptoms, also negative symptoms. Coming to the diagnosis, so what are the diagnoses we can use based on the clinical assessment? So we need to get the clinical assessment like physical examination, mental status examination, mini mental status examination and history collection. History, mental status examination. No specific lab test, but brain imaging may support the diagnosis. So we need to get the imaging of brain like CT or MRI scans. Coming to the treatment, so case treatment, medical, so antipsychotic drugs. So schizophrenia is mainly treated with antipsychotic drugs like haloperidol, risperidone, electroconvulsive therapy in severe cases, ECT also in severe cases. Coming to the psychosocial, like we need to give them psychotherapy, family counseling, social skill training and occupational therapy. So these are the general treatment. So what will be the nursing management in schizophrenia? Build trust and therapeutic relationship with the patient. Ensure safety of patient and others. Provide reality orientation. Administer medication as prescribed. Encourage self-care and social interaction. Educate patient and family. So these are the general nursing management in schizophrenia. So next we are going to discuss about mania. So what is mania? Let's see. So it is abnormally elevated, expansive or irritable mood. So that person will have hyperactive it will be. So abnormally elevated, expansive and irritable mood lasting for at least 1 week and is usually associated with increased energy, overactivity and impaired judgment. So that is what called mania. So it's a abnormally elevated, expansive or irritable mood lasting to 1 week and is usually associated with increased energy. So that person will have increased energy, hyperactivity and impaired judgment. So that is mania. So what are the causes and risk factors of mania? Bipolar disorder in the manic phase. So that person had bipolar disorder if he is in manic phase. Genetic factors, neurochemical imbalances like increased production of dopamine and norepinephrine, sleep deprivation, substance abuse and medication side effects. So these are the causes or risk factors. Coming to the clinical features, symptoms of mania, mood, how the mood will be elevated, euphoric or irritable. So their mood will be elevated and they are very energetic, will be euphoric and irritable. Speech, rapid, loud, pressured speech. So rapidly they will continuously speak and their loud voice, they will speak in loud voice and also pressured speech will be there. So what is pressured speech? They will continuously without non-stopping, they will continuously speak. Thought. How their thoughts will be flight of ideas, inflated self-esteem. So here flight of ideas from one idea to another idea, they'll jump easily. So flight of ideas. Activity, overactive, restlessness and distractible. Sleep, decreased need for sleep. So they won't sleep properly. Sleep deprivation will be there. Behavior, risky actions like overspending, sexual activity. Poor judgment, impulsive decisions without considering any consequences. So these are the clinical features or symptoms of mania. Coming to the complications, it is injury to self or others. They'll harm themselves or they'll harm others. Financial or social problems, psychosis in severe cases, hospitalization may be needed. So what are the treatment? Medications like mood stabilizers. So in mania and depression, we'll use mood stabilizers like lithium or valproate. Antipsychotics like olanzapine and haloperidol. Benzodiazepines for short-term agitations. Psychotherapy like supportive therapy, psychoeducation and family counseling. So coming to the nursing management of mania, ensure safety to prevent harm to the due to impulse behavior. Ensure safety of patient as well as others. Maintain low stimulus environment. So what environment? It should be low stimulus. Set clear firm boundaries and limits. Encourage rest, food and fluid intake. Monitor medication effect and side effects. Provide emotional support and family education. So this is nursing management in mania. Coming to depression. So if you are studying about mania, you also study about depression. So what is depression? It's a mood disorder characterized by persistent feeling of sadness, hopelessness, and loss of interest, decreased energy affecting the daily function. So that person will have feeling of sadness, continuous feeling of sadness or hopelessness be a loss of interest and decreased energy that is affecting the daily life. So that is depression. So what are the causes and risk factors here? Biological factors like neurotransmitter imbalance, decreased production of serotonin or norepinephrine, genetic predisposition or family history, stressful life event like loss of somebody, loss or trauma, chronic illness, substance abuse and hormonal changes. So what are the clinical features or symptoms of depression? Low mood, persistent sadness or emptiness. So they'll have persistent sadness will be present. Loss of interest in previously enjoyed activities. Before they enjoyed that activities in the past. So now they have loss of interest in that activities. Sleep changes like insomnia or excessive sleep will be there. Appetite, weight loss or weight gain will be there. Fatigue, lack of energy, feeling of guilt or worthlessness, poor concentration, suicidal thoughts or behavior. So these are the clinical features of depression. Coming to the type of depression, major depressive disorder, persistent depressive disorder, postpartum depressive disorder, seasonal affective disorder and psychotic depression. So what are the treatment? Medications like antidepressant, that is sedative, serotonin reuptake inhibitors like fluoxetine or sertraline. Monitors for side effects and suicidal tendency. So as a nurse you need to observe the patient because they have suicidal tendency. Psychotherapy like cognitive behavior therapy, supportive and interpersonal therapy. So other treatment include ECT, electroconvulsive therapy for the severe cases of depression, lifestyle changes like sleep, exercise and diet. So coming to bipolar disorder, so it is also a mood disorder characterized by alternating episodes of mania and depression. So that alternating will be there, sometimes mania, sometimes depression. So it is alternating, changing. So that is with periods of normal mood in between. So mania, normal, then depression. Again depression, mania and again normal. So that is what we call bipolar disorder. So type of bipolar disorder, bipolar 1 disorder, it is at least one manic episode, often with depressive episodes. One manic episodes and other will be depressive episodes. Bipolar 2 disorder, hypomanic episodes and major depressive episodes. So hypomania will be there, major depression will be present. Cyclothymia, chronic mood fluctuation with mild depression and hypomania. So they have chronic mood fluctuation but they have mild depression and hypomania. So that is cyclothymia. So coming to the causes and risk factors, it is genetic factors like family history, neurochemical imbalances like again, example, dopamine and serotonin, stressful life events, substance abuse and sleep disturbance. Coming to the manic episode symptoms. So in the episodes, if that bipolar disorder, that person is in manic, then what are the symptoms will be there? Elevated or irritable mood, overactivity and restlessness, decreased need for sleep, inflated self-esteem or grandiosity, rapid speech or pressure of speech, risky behavior like spending or sexual activity. So depressive episodes, what are the symptoms will be there? Low mood and energy will be, sleep disturbances, either insomnia or hypersomnia, either that person will excessively sleep or not at all sleeping. Loss of interest or pleasure, feeling of worthlessness or guilt, suicidal thought and poor concentration. So this is depressive episodes. So what are the treatment? Mood stabilizers like lithium, antipsychotics like olanzapine, antidepressants used quotiently. So coming to the psychotherapy, it is mainly cognitive behavioral therapy, psychoeducation and family therapy. So next we will see another important topic, that is admission procedure in psychiatric hospital. So admissions, what are the types of admission in a hospital? First one is voluntary admission. So it is section 86 of Mental Health Act 2017. So patient willingly seek treatment and signs a written request for admission. So patient खुद आ जाएगा admission करने के लिए, involuntary और voluntary में आएगा, मुझे hospital में admission चाहिए, ये बात बोलकर वो लोग hospital में आकर admission लेगा, that is is voluntary admission. Coming to the involuntary admission, it is under the special circumstances when patient refuses treatment but poses danger to others and self. So require medical certification and approval under mental health law. So patient approve नहीं करेगा hospital जाने के लिए, but patient he is risky for himself and others, then we will get him to admitted. So that is involuntary admission. Third one is emergency admission under the section 94 for immediate care when patient is violent, suicidal or harmful. So immediately we are admitting the patient because the patient may be violent, harmful or suicidal thoughts will be there. Next one is admission under magistrate order. So based on the legal authority, court order for the mentally ill and wandering or without caretaker. So the court is admitting, the magistrate is admitting a patient with his court order. So that is one where we are admitting the patients mentally ill, wandering or without caretakers, the patient is there, we will administer them with the order of a magistrate. So that is admission under magistrate order. Next, fifth one is admission of minor, like below 18 years of age. So done with the request of guardian or parent with the medical certification. So from the guardian or from the parent and with the medical certification we can admit a patient who is minor. So that is, these are the types of admission procedures. Coming to the discharge procedures in hospital. So what are the discharge one? It is planned discharge. So based on the doctor's advice when patient is able and fit to go home. So after the treatment, patient is fit. He is not having the symptoms. The doctor is telling him to doctor, with the doctor advice we can discharge the patient. So that is planned discharge. Coming to discharge on request. So it is patient or family discharging if voluntary and mentally fit. So the patient voluntary, the patient come to the hospital. After treatment, he is asking for the discharge, then we can discharge the patient, or the family is asking, then we can discharge patient, that is discharge on request. Next is discharge against medical advice, DAMA or LAMA. So patient leave the hospital against medical advice after signing legal forms. So after the signing legal forms, that patient is refusing to take the treatment, then we are discharging the patient against the medical advice. Next is discharge by review board or the court. So the patient who is admitted involuntary or under the legal. So the magistrate or court has admitted some patients. So that patients need to get discharged. So they review from the board or court. Then only we can able to do the discharge. So this is the types of discharges in a psychiatric hospital. So what is the role of nurse in admission and discharge? Ensure all the legal documents and consent are complete. So we need to see all the legal documents are complete and the consent is made, and explain the hospital rules, rights and treatments to the patient, maintain patient privacy and dignity, provide discharge education like medication, follow-up and relapse signs, coordinate with family and community services. So this is the role of nurse in both the admission and discharge procedures. Coming to the next important topic, that is therapeutic nurse-patient relationship. What it is? It's a professional, planned and goal-directed interaction between a nurse and a patient, focusing on improving patient's mental, emotional and physical well-being. So it's a relationship between the nurse and the patient to treat the patient. So for that, it is the relationship is made. That is what called therapeutic nurse-patient relationship. So let's discuss about the phases. So what are the first phase? Pre-interaction phase. So nurse prepare mentally before meeting the patient, review patient history and assess on feelings. So before meeting the patient, nurse will prepare herself to meet the patient and she will go through the patient file and history. So that is pre-interaction phase. Coming to the orientation phase. In the second phase, it is orientation phase where first meeting with the patient. So the nurse will first time meeting the patient, building trust, explaining the roles and setting goals. So they will introduce each other and they will build the trust. They will explain about the roles and setting the goals. So in the third phase, that is working phase. So what is working phase? Maintaining the therapeutic work phase. So here what we planned, we are implementing the plans. Patient expresses feelings, nurse will provide the support and guidance in the working phase. In the last, that is termination phase. So relationship ends due to discharge or goal completion. So either the patient is getting discharged or the patient's treatment is over. So then we will end that or terminate that relationship, evaluating the progress and providing the closure. So this is the phases of nurse-patient relationship. It is pre-interaction phase, orientation phase, working phase and termination phase. So what are the characteristics of therapeutic relationship? So it is mainly goal-oriented and purposeful, time-limited and it is professional, based on the trust and empathy, patient-centered, respectful and non-judgmental. So these are the characteristics of a therapeutic relationship. So what are the principles of therapeutic relationship? Accept as they are, accept the patient as they are, maintain confidentiality of the information, be genuine and empathetic to the patient, use active listening and open communication, encourage independence, maintain appropriate professional boundaries. So these are the principles of therapeutic relationship. Next we will see Mental Health Care Act 2017. So what is Mental Health Care Act 2017? It's a law enacted to protect the rights of persons with mental illness. So it is a law that protecting the person's right, the person who is mentally ill, his rights. So and to ensure mental health care and services in a dignified and non-discriminatory manner. So without any discrimination, that person is getting the mental health services. For that, the Government of India has passed Mental Health Act in 2017. So what are the important provisions of Mental Health Care Act? Right to mental health care. So each mentally unhealthy individual have the right to get the mental health care. It should be access to affordable and quality treatment. Right to dignity, no discrimination or inhuman treatment. So they are also, it's people. So we are also an individual, they are also an individual in the society. So they need to get the no discrimination and inhuman treatment. So they should have the non-discriminative and inhuman treatment. They need to get the dignity and respect. Right to confidentiality. Patient information must be kept private. So a nurse or a person who is treating the mental health illness disease or you are not supposed to share any information to any other person. So right to confidentiality, right to make advance directive. Patient can choose future treatment preferences. He is an individual, he or she is an individual. They can also choose what their treatment should be in the future. Right to have nominated representatives to assist in treatment decision. They can nominate one person from their family or friends or relatives. Decriminalization of suicide. So suicide attempt seen as a sign of mental illness, not a crime. So if a mentally unhealthy person is committing suicide or trying to commit suicide, it is not coming under criminal law. It is coming under as a signs and symptom of a mental illness. Free mental health services, especially for people below poverty line. So if they are below poverty line, they need to get the free treatment. Mental Health Review Board, monitoring patient rights and hospital procedures. Regulation of mental health establishment. All centers must be registered. Like the persons, they are treating the clinics, hospitals, the asylums where the mentally health patients are getting treatment. It should be registered under the government. Promotion of community-based care, encouraging treatment outside the hospital. So these are the important provisions of Mental Health Act in 2017. So let's discuss about rights of a mentally ill patient. So what are the rights of mentally ill patient? Right to access to mental health care. So they have the right to get the best treatment, right to live with dignity, right to have confidentiality, right to get informed consent, right to get free treatment for poor or homeless people, right to make an advance directive, right to appoint a nominated representative, right to protection from cruel, inhuman treatment, right to community living, and right to legal aid and complaint to Mental Health Care Review Board. So these are the rights of a mentally ill patient. So they are also a human, they are also individual in our society. They need to get the respect and dignity and the best possible care. So these are the rights of mentally ill patients. Yes. So till now हम लोग आज डिस्कस किया था मेंटल हेल्थ सेकेंड ईयर JNM का मेंटल हेल्थ नर्सिंग important questions. I hope everyone understood. So if you have any doubts, please comment below and also purchase and subscribe Easy Nurse from Play Store or App Store. So you can able to see all this topic what we have discussed, the further explanations. If you want, please download Easy Nurse from Play Store or App Store. So till now we have discussed about all the important questions. So I hope everyone understood. So we'll meet in the next sections with another interesting topic. Till then, thank you.